And for more on this so-called ChatGPT-induced psychosis, as well as insight into how AI and mental health communities are responding, I'm joined by Krista Thomason. She's an associate professor of philosophy at Swarthmore College and an expert in the philosophy of emotion. Krista, welcome to the show. Great having you. And what do mental health professionals have to say about this ChatGPT-induced psychosis?
Thanks so much for having me. So this is an emerging phenomenon, and at the moment, mental health professionals don't actually have a clear, one univocal view about how ChatGPT psychosis is affecting all of us. There are ongoing conversations and have always been for the mental health community about the uses of chatbots in therapy. Much of that evidence is fairly mixed in terms of their performance, but because ChatGPT's induced psychosis is a brand new thing, we're still very much in a kind of pioneering stage trying to figure out what to say about it.
And as far as we know, is this condition more common among young people or older people?
The cases so far, the ones that have been the most high profile, have mostly involved adults, but there are at least a few cases that have involved teenagers. So the company Character AI, for example, is currently the subject of a few lawsuits having to do with teenagers. At least in one of those cases, one of the teenagers ended up dying by suicide after prolonged engagement with a chatbot. So even though most of the time we're talking about adults here, there's reason to be worried about youth mental health.
You're bringing up a very interesting point, Krista, because if adults are more exposed to this, and several voices have spoken for the use of LLMs, large language models, to keep older people company, especially towards, hospice care and so on. What kind of mix are we trying to put together?
It's interesting that these kinds of things are recommended. I think oftentimes we get caught up in the idea that things like chatbots are more accessible. And the thought is supposed to be because they're very accessible, then they sort of lower the barrier of entry for people who might otherwise have a hard time finding help. But at the same time, we also know that people who use things like social media, for example, have become more isolated and withdrawn. And it seems like the use of ChatGPT would actually make that problem worse. So we really have these kind of two conflicting threads in the conversation right now, particularly when we're talking about older adults.
And there's also another angle I'd like to explore because the excessive use of an AI chatbot would also impact people, for example, suffering from obsessive compulsive disorder or any disorders that are already there, right?
That's right. And at the moment, again, because ChatGPT is a very new technology, there's very little evidence to weigh in on any of the way that it might interact with particular disorders, including OCD. But there have certainly been some clinicians who have been concerned about the interaction between ChatGPT and OCD. So you can imagine that someone with OCD may not be helped by, for example, excessive Googling about, let's
Yeah.
suppose they suffer from hypochondria and they start looking for physical symptoms online. You can imagine that that same problem would repeat itself with something like ChatGPT. So it may lead people further into their obsessive thoughts as opposed to farther away.
Krista, do you think that OpenAI, the company that actually manages, owns ChatGPT, do you think that OpenAI takes all these concerns seriously?
What's very telling, I think, is actually when you read the reports of ChatGPT-induced psychosis and you see what the official response is from the company. What I think is sort of most telling about that is that they really seem to be pretty blindsided by this phenomenon. Now, you might think it may have been unfair for them to have anticipated something like this because when you and I read the stories about ChatGPT psychosis, it seems pretty hard to believe. But it is a little bit unsettling to think that the company seemed not to anticipate this kind of problem at all. And one worries that maybe they don't have as much knowledge about the complexities of human psychology as perhaps they should.
And one or two pieces of advice to keep away, prevent any, harmful relationship with a chatbot of this kind?
I think users really need to remember that ChatGPT is essentially a glorified text predictor. It is trying to generate plausible sounding text based on statistical analysis. And I think we make a mistake if we think that ChatGPT is our friend, that ChatGPT is our counselor. We shouldn't sort of mistake that what seems to be intimacy with a chatbot for real intimacy that we would have with another human.